If you work in healthcare and you want to become AI literate, you're in the right place. I'm Dr. Dave. I'm an ICU doctor building real-world AI. And my goal is to make you AI literate in 30 days. Today is day 15. We're starting week 3, and now we're looking at how we can turn a general-purpose AI into a medical expert. This first phase is called pre-training. Think of it like the first 2 years of medical school, the pre-clerkship years for LLMs. In the first 2 years, you really aren't seeing patients. You're in the library, you're learning everything, absorbing the language of biology, Krebs cycle, anatomy, pathology, physiology, everything. You have massive book smarts. I was probably the most knowledgeable I was when I was in medical school, to be honest. But at that stage, you've never really actually managed a crashing patient, or you know what heart failure truly looks like. So how do you teach a machine how to read the internet? You use a technique called self-supervised learning. Imagine I gave you a medical textbook, but blacked out every 10th word with a Sharpie. Your job is to guess the missing word based on the context of the sentence. If you guess wrong, I tell you the correct word and your neural weights adjust. If you guess right, those neural connections get stronger. Now imagine doing that trillions of times across the entire internet. Wikipedia, PubMed, Reddit, and millions of books. During pre-training, the model isn't learning facts, it's learning the statistical structure of human thought. It builds a map of how concepts relate to each other. It learns that myocardial isn't always followed by infarction, and that shortness of breath often appears in the same neighborhood as pulmonary edema. So basically, pre-training creates what we call a base model. It's brilliant, but it's unaligned. It understands the syntax of medicine, but it doesn't really have the clinical gestalt yet. If you ask a raw base model for a diagnosis, it might give you something that's technically correct answer from a textbook, but it won't understand the nuances of a bedside presentation or the ethics of a DNR order. In healthcare, this is a huge safety point. A lot of free and older AI models are just base models. They're brilliant students, but they haven't done a single day of clinical rotations yet. So would you really use a pre-clerkship med student as your doctor? Comment with the most useless fact that you had to memorize in med school in the first 2 years. For me, it was the Krebs cycle. I can't recall another time that I had to use that, maybe in residency, but after that, I can't recall. Let's see who had it worse. And follow and save this. Tomorrow, we'll talk about fine-tuning, or what I like to call AI residency. And we'll see how we can force feed these models the gold standard of medical data to make them safe for the bedside.